we'll get the Monday, October 17th, 2016 Board of Health meeting called to order. We'll start the meeting with the Pledge of Allegiance. Would everyone please rise? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, fellow board members, for coming this evening, and some public participation, it looks like, tonight. Thank you. Okay. So, no? We're going to be.
Oh, we're going to talk chickens.
That was an interesting topic. Okay. All right. So, let's just, I guess, start the meeting with just a review. The September minutes, I believe, that were emailed out early last week. Did anybody get a chance to review those, I hope? I'm looking for my copy. Oh, here it is. Okay. Awesome. So just any updates or suggestions for the minutes? Anything else? No? So we'll just kind of start on a movement to approve the minutes so we can post those on the website. So moved. And a second with all 6 of us here. Great. And all those in favor say aye. And all those nays, nay, no nays. Okay, so we will approve those minutes and get them on the website. Amy, over this month, thank you very much. We did get, I think, that settled out where the meeting minutes are going on the website. I appreciate that.
That was Jim, actually.
Thank you, Jim. Thank you, Jim, for getting that on the website. I did look at the website a couple of days ago and did see where you can find those on the website now, all minutes from former meetings. Okay. Mr. Taltone, can we do the health officer's report, please?
Good afternoon and welcome to the October the 17th, 2016 Board of Health meeting of Radnor Township. My report for the month of September were 20 food safety inspections, 8 bathing place inspections, 4 quality of life issues. I forgot to mention before I started that nurse or Dr. Fitzpatrick won't be out tonight because of another meeting, and Mr. Kane, Kevin Kane, won't be here because of his illness. And our next Board of Health meeting will be November the 21st, 2016. As far as upcoming events, we have yesterday was the fall harvest and great pumpkin patch. I think Ms. Hopko will be talking a little bit about that later on in the meeting. October the 29th, 2016, be free eye care and eyeglasses for children from 8:30 a.m. to 1 p.m. at Jefferson Alumni Hall, 10th and Locust, Philadelphia, PA. I'm not sure what the age range is, but there's a telephone number that people can call. That number is 215-563-5848, extension 21. And then there's another reminder regarding the Commonwealth of Pennsylvania Second Annual Teen Health Week. As far as the assistant health officer and health inspector, rather, we're still taking interviews. We're still doing taking resumes and applications. To that end, so ends my report.
Thank you very much, Larry. Appreciate that. So I think we'll move on to some old business. One of the things that we talked about at the beginning of this new business year is to just try to get some things off our plate from old business from last season. And one of those items is the revision or approval of recommendations on 2 things that the Board of Health has been speaking about over the last year or so. One is the safety of humans and animals in dog parks that allow leash-free walking of dogs and leash-free play of dogs, and the other is recommendations about safety of artificial turf fields or crumb rubber fields. So since I forgot to make the copy of it, I'm going to open this document up and read through our one of the attachments that I sent to everyone this month and see if we can vote on these to approve. So here's one up here. All right. So let's see. So the first one is for the turf field, and written as this. If there's any revisions to be made, please let me know. The Radnor Township Board of Health has discussed the safety of artificial turf fields, also known as crumb rubber turf surfaces. Current consensus is that these fields are safe for the youth in our township to use for practice and play, and while the Environmental Protection Agency, the EPA, and the Centers for Disease Control, the CDC, and the Consumer Product Safety Commission embark on a more complete study of the safety of these playing surfaces, the board has reviewed the current literature and has had guest speakers to inform us about the current science and studies. We propose that the township install signage that indicates that hand washing after playing on these fields is the safest way to prevent exposure to any harmful chemicals. We also propose that a more accessible hand washing station be available at parks where these fields are located. We will continue to keep the township updated as further studies and conclusions are released on the federal level. So I think that would be a reasonable recommendation to the Board of Commissioners. Okay, so we'll vote on recommendation number 1 from the Board of Health, the recommendation for signage at turf fields. Any, I guess we have to bring it to the floor for voting. Anyone would like to bring that to the floor to vote?
I move the recommendation.
Move for the recommendation. Any yays? Everybody's yay on that vote? Yes, yes, yes? Okay, all yeses on that vote, no nays. Okay, so we will recommend the turf field recommendations. And let me get to number 2. And while this is loading rather, we also want to think about some older business that we had last year. It's not working well, including the chicken issue. So we will have, we wanted to get back into that again, thinking about, sorry guys. Thinking about, last year, I believe, or maybe it was 2 seasons ago. Was it last season or 2 seasons? It was 2 seasons ago. We had discussed it, and I'm not sure if it was, I was not present at the time, but was there a formal recommendation made at that time? Do we remember? There was? Okay. We should probably look back and see if an actual formal recommendation was done. Yeah. But I think that there is a consensus in the community, at least from what I'm hearing from people, that people do want the ability to, and the sort of the permission to keep chickens on their property. And I believe that we went through a lot of evidence with Dr. Donato about the safety of such a proposal. And it seemed that there was some concern at the time about salmonella. However, the concern was relatively low on the scale of concerns. So I think that I think it's something we should continue maybe to look at anything, if there's newer evidence, if anybody has any newer evidence on that, and bring this back up again and see if we can possibly give a recommendation from the board again and see if the commissioners would be willing to allow for some of that to happen in the community, to have us have chickens. Okay. It's still not loading in. We might have to get back to that after we get to some new business. I'm having trouble getting that to load in. I apologize. Okay. Well, we'll move on to new business, and if this loads in a little bit later, I will bring up the old business again. Please.
So process-wise, I mean, if we move these forward, and maybe this is a question for Mr. Nagel, not only these recommendations, but looking back 2 years ago when the recommendation went to the commissioners for the chickens, what are next steps, and what kind of a timeline can we expect?
At the next meeting, there's a section of the meeting dedicated to Board of Health where I report back. So we would report on these issues, and then we'd get them on the agenda to have a vote on them.
Your next meeting is when?
No, next Monday.
In 2 Mondays.
No, next Monday.
This Monday coming up?
Yes.
Okay. Okay.
And I will also provide a paper copy of the formal recommendation to Mr. Nagel over the next couple of days via email. I may have gotten the original one, I'm not sure.
And Larry can make sure that gets into the packet for the meeting.
All right, we finally
Now,
loaded in here. So
Some of what I heard you say already are really quick and simple, and we'll just refer them to, like, the Parks Department, for example.
Okay.
The others, like the chicken thing, obviously, there'll be some discussion amongst the board members, and we'll have a public hearing.
Okay. Item number 2 for the closing out the old business from last week as well. The recommendation to from the Radnor Township Board of Health for the dog parks. The Radnor Township Board of Health has discussed the safety of animals and people in the leash-free parks of Radnor Township. Current consensus is that unneutered male dogs often display more aggressive responses around other dogs and may be more at risk for unpredictable behavior. We propose that the township install signage that indicates that unneutered male dogs over 8 months of age should be leashed while outdoors. As always, the Radnor Township Board of Health encourages sterilization of all male and female dogs by 6 to 8 months to prevent breeding and pet overpopulation. Any additions or updates to that? Anything you can think of? No? Okay, so this really just came from our research from our board members here. Thank you very much for that. And so we will also, anybody want to bring that to the floor to vote?
So moved for the recommendation.
So moved. Okay, and we will vote on the proposal. All in favor, say aye.
Aye.
And again, nays? None. Okay, so that will pass as well. So two proposals we bring to the Board of Commissioners for this upcoming meeting, and again in the future, in the next meeting or two. I think we should bring up the chicken ordinance again, and also just get up-to-date information so we can make an educated proposal to the board. Sure.
I have a question about the chicken ordinance. So I'm looking at it now, the one that was prepared, I think, in the fall of 2013. And so should we go over it at the next meeting, or should we submit? There's no date, but it's, this is the formal one that the board approved, I think, in the fall of 2013. And then it went to the commissioners, and I think it just, it got caught up in the Ardrossan stuff, and it was never discussed. So, if
How detailed is it?
it's pretty, well, it's pretty detailed. I mean, this is complete, but if we want to look at it again for revisions before resubmitting it. So
That's on the website?
No, somehow I have it in my, this I think was put together by Dr. Donato. So.
Let's get that emailed around to the board members
Okay.
this month.
I'll do that.
Can we
we
take
can
a
all
look at
review
it? Because
Yeah.
I don't know the history.
Right.
And then the Township Commission didn't act on it? Or didn't?
No.
So it's still sitting in la-la land?
Mm-hmm.
Okay, so let's take a look at it and see.
I think that's a good idea for this month to plan on some of that. Okay, excellent. Other comments? No? Okay. We should move into some new business. I know we have to, this room needs to be used later. So the first thing we'll do is I will ask Dr. Leader and to inform us of our new student interns. And Ms. Shane, too, if you guys know those.
Yeah, so Linda and I are the sort of subcommittee to find interns every year, and I thank you so much for doing this. And so when we reached out to the guidance counselors at Radnor High School looking for sophomore student interns interested in health, we received an abundance of interest in applications, which was really fantastic. And in the end, our two new interns really bubbled to the top for both of us. It was a very quick and easy decision after we had read through them. They would just seem like really natural fits. So I'd like to introduce Joanna Vines and Minjong Kwan as our two new interns, and if you could just tell us just a little bit about yourself, that'd be great.
Hi, I'm Joanna Vines, and I row for the Radnor Girls Crew Club. I'm also part of the Annenberg Science Club at my school, along with the Neuroscience Club, and I'm really looking forward to getting to know everyone and to work with you this upcoming year.
Hi, my name is Minjong Kwan. I'm a sophomore with Joanna, and I am a senator for class of 2019. I'm part of Math Club, and I'm really excited to be here.
Welcome. And maybe it would be wise for us to introduce ourselves to them so they know who we are. Do I mind putting you on the spot and going just down the line?
No, I'm Joan Capuzzi. I'm a veterinarian, and I've been on the board for, I guess this is my second year.
So I'm Amy, who corresponded with you. I'm a public health professor at Jefferson during the day, and I've been on the board, I think, 5 or 6 years now. I'm coming towards the end.
I'm Andrew Foreman, and I am a pediatrician in Paoli, and I am also a father of 2 children in this township, so wanted to be involved on the board for the health of the community and also just because my children live in this community.
Good afternoon. I'm Linda Shaney. I'm the nurse educator in Bryn Mawr Hospital's emergency department, and I've been on the board a little more than 3 years, and I have loved every minute of it and learned a whole different perspective outside healthcare in our township and community. Welcome.
Hi, welcome, ladies. My name is Kathy Durr. I am a laboratory scientist currently working for Siemens Healthcare, and I do laboratory workflow studies throughout the U.S., and I'm glad you guys are on board. Welcome.
Hi, I'm Nancy Schartz-Hopko. I'm a professor in the College of Nursing at Villanova University, and I joined the board in January, and I agree, I've learned so much about the township from a different lens, so welcome.
Welcome, folks. All right, we'll speak a bit more with you folks in the next coming meetings concerning a project for the year, and we appreciate you guys taking some notes on the meeting and helping us out with the minutes. That's very much appreciated. All right. So something that may be of interest to our students is coming up in January for Teen Health Week. We've been talking about this at the meetings for the last couple of meetings, and we discussed it a bunch last year. But this year's sort of skeleton of a plan, thanks to Mr. Tautone, will be we're going to try to hit these 5 topics that will be covered for Teen Week prior to Teen Health Week starting. And the topics include nutrition and fitness, violence prevention, mental health issues, sexual health issues, and substance abuse. We're starting on that process already. We were thinking about each month trying to get just information about each topic, whether it's a presentation from one of the board members. We sometimes make a small 5 or 10-minute presentation during the meeting about a public health issue, or to put something onto Radnor Health Matters, which is a television show on the on-demand network here in Radnor Township. One plan that we have, or that should be going in November, is an interview on the Radnor Health Matters show by a local media coach who will be interviewing an expert in suicide prevention, so going more into the mental health issues. And that is being planned as we speak, as soon as we can coordinate the schedules for the interviewer and the interviewee, so that hopefully by next meeting we'll have an announcement about either the date or if it's already happened by then, I'm hoping. So anybody on the board who would be interested in one of those topics, nutrition, fitness, violence prevention, sexual health, or substance abuse, I think would be excellent if we can have a presentation in November, and also one in December, coming up to Teen Health Week in January. So if anybody can think of something, or has an expert who wants to be on television or who could be on the television station, be very simple, probably a 25-minute, 30-minute kind of interview thing planned out so it looks, so we can get some good information over that period of time. Okay. So that's something to think about for next month. Please email me this month if you can be put into the agenda for a presentation or into December, either one.
Can you quickly repeat those 5 topics,
Sure.
5 days?
So the nutrition and fitness, violence prevention, mental health, which I think we got covered, sexual health, and substance abuse.
Got it.
And certainly, we have covered quite a bit about substance abuse last year, thanks to Ms. Shaney last year with a great presentation about opioids. We can continue on that topic and kind of remind everyone of the issues with that. And I think bringing it into a teen health perspective, just so everybody remembers, we had a presentation last year about opioids and the dangers that they are, and most of them are coming from prescription medications at first, and then people may get addicted to those prescription medicines and move on to some of the illegal drugs like heroin and some other ones on the street. So moving into teens, I think it's a good place for us to talk a little bit about how available these medications are at people's homes. So I think that'll be a nice topic to also bring up. All right. Other new business we can move on to, if you don't mind. We'll move on to the fall harvest event. If Sapko, tell us a little bit about that. Thank you.
So the fall harvest event was postponed to yesterday due to rain on the 9th of October. So yesterday I was present there. We had materials on a Parks and Recreation table, and opportunity for people to fill out a little survey form, but nobody did that. So I walked around and talked to people and got some data from interviews. I approached a lot of people. It turns out that although it's a well-attended event, it's a lovely event. A lot of the people are from outside Radnor Township, but I found 15 people ranging from high school through retired people, and was able to get a few comments. Only 2 people acknowledged that they watch our show, and one of them is one of our commissioners. So that was a little discouraging. And I provided reasons why they don't, which is understandable to all of us sitting here. We're all very busy people doing other things. But some of the comments I got were informative. We had a person who was unhappy after a bad exposure. She contacted the township and I think this is what this says to me. She was unhappy because they referred her to a physician for rabies vaccine. She had expected the township to provide this. So I think that what that says to me is we can always be vigilant about our website and what the expectations are and the information that we provide, so that we don't, give people false assurance that we are direct providers. Another person had very strong feelings about particulate matter being generated by the Lancaster Avenue Development Project and by the biomedical project that's soon going to come. They pointed out that District 7 is a densely populated district. It's got a lot of senior citizen as well as student athletes, to say nothing of people with asthma. And so this person was concerned that we might want to consider monitoring strategies and whether or not there need to be some kind of limits over which alerts are issued or even postponing of work. Another couple of women talked to me with pretty much a high degree of zeal about the possibility of a township composting program, so that people would be encouraged to grow vegetables and combat obesity in that way. And the rest were, one person was worried that at times when there's, particularly during a drought, their tap water tastes and smells what they called chemical. Otherwise, people were generally positive. We had compliments on our fitness program, Radnor Steps. We had a direct compliment to Mr. Taltone about how supported a restaurant owner feels getting guidance as they deal with maintenance and renovation issues. Somebody's happy with the Wayne Senior Center programming, satisfaction with water, air, and healthcare quality. One person did observe that healthcare costs too much. I think that's beyond our ability to intervene at the township level. But it was worthwhile. I was glad that I went.
Good.
Thank you so much for going. We appreciate that.
Excuse me, could I give you a little feedback on a
Sure.
couple of those items? One, as you all know, or should know, the township does compost all the leaves they pick up. And those leaves then are, that mold, leaf mold, once it rots down, is made available at numerous locations throughout the community. We also collect yard waste every Wednesday.
Okay.
The township owns, they call it tub grinder, which can process limbs, major limbs of trees and big pieces of wood, and process it into chipped wood for mulch, which we use at our own parks and facilities. We'd kicked around collecting compostable materials and felt that it was really overly burdensome. However, the EAC over the years has run several programs on composting, and at one point I believe they sold or gave away compost bins. You might want to talk to them about doing that again. There was an item about insecticides. The township, as a rule, uses very little insecticides or herbicides. We changed over from, they were using, do you know what the new brand is? They changed to a supposed environmentally safe herbicide this year. So at the end of the season, we're hoping to get a report back from Steve Norsini about the effectiveness of that. And that's about it.
Thank you. The two people interested in composting are my neighbors, so I will let them know that.
I don't believe I had any other new business scheduled. Did anybody have anything pending that wanted to speak about? No? Okay. So we are making good time. We'll move on to announcements.
Did you want to address particulate and dust off the?
Yeah, that's an interesting question.
Well, you know, we do have inspectors full-time at the construction sites. One of the items they're supposed to be looking at, I won't comment on whether it's effective or not, or whether, but is dirt coming off the site, water coming off the site, and dust. They're all items that they are responsible for. Biggest problem we found over the years with these kind of issues is the lack of standards that we can, we found this especially with noise. There have been problems at a couple construction sites in town with noise. And we found distinctly lacking was good standards to apply.
Is the construction, I know it gets very dusty because I live out that way. I don't have any asthma, I don't have asthma issues, but I'm sure people in the humidity and the asthma was getting to them. But I don't know if there is a project manager at the site that is monitoring that, not from our side, but they must have something they're looking at to say, the dust is just kicking up too much. When they're grinding in the streets especially, it kicks up.
The township has an inspector there, and that's one of their charges, is to pay attention to that
To pay
kind of
attention
issue.
to the dust particles?
Right. Again, I don't think they're drawing air samples or anything like that. It's not scientific, I believe.
It does look like most of the work, most of the dust-up work was done over the summer, and that it's kind of calming down. But what I do notice in the mornings, because I drive down Ithan every morning, and I see just this beeline of students walking right past all the construction, and I feel kind of bad for them, because if anybody is going to have, you know, close exposure to it other than the people working at the site, it's the students who are walking right past it. And there are companies that can monitor two types of pollutants. One is the actual gaseous pollutants, and the other is particulate matter, and maybe that might be an idea for any companies that are doing work like this in our township, you know, that they have to purchase these systems and have them in place. But also, you know, at a lot of construction sites, and I noticed that this one does not have it. They have fences, but seems like the better plan is the fences that have these tarps along them, and this one does not have them. And it might be an idea that maybe Villanova or the construction company could provide, at least offer masks that the students can wear when they're walking past the site, if they want to.
There's a committee that meets once a month. Matter of fact, I think they meet this Thursday, don't they, Sarah? Called CARE. And it'd probably be good ideas to provide them with these suggestions and let them discuss them. Larry, can you make sure they get that information? Yeah. Steve Norsini.
It's called CARE, air quality. Okay, so let's see if I can make some emails this month as well.
Citizens action and
Okay.
really efficient stuff. It's VU Care
VU.
Wednesday the 19th.
Okay, so when?
It's an uncommon meeting. Normally they meet the first Thursday.
Okay, so it's VU Care, and they're meeting this Wednesday, the 19th. And they usually meet the first Thursday, okay, in this room. Okay, so maybe we can get some suggestions to them as well and find out what they're doing. Okay, so moving on to some announcements. October is Breast Cancer Awareness Month. As you see, the NFL football players wearing the pink socks this month, and hopefully we are all participating in some kind of awareness events or in some fundraising events this month at some point. There are many, many wonderful events for Breast Cancer Awareness Month. It is also ADHD Awareness Month. ADHD is the most common neurodevelopmental disorder of childhood. It can be specifically diagnosed with certain neurologic testing. There is probably too many medications prescribed for ADHD in the country. However, the medications and the therapy that are used for ADHD can be extremely helpful and are very well scientifically based. So I think that it's important for parents to understand that this shouldn't be a stigma for children, and they should be diagnosed and treated, and certainly help with their mood and their future in education and staying out of the criminal court system. So that would be excellent for everybody to be aware of attention deficit disorder and its diagnosis. We also remind everyone in the community that flu vaccines are available, and it is the prime time to get your flu vaccine. Okay, they are plentiful. There is no more nasal spray. The old flu mist has been discontinued, so this year is only injectable vaccines. And reminding everyone the vaccine is a dead vaccine. It cannot cause the flu. It can cause people to feel achy in the arm where they got it. I can attest to that. And it can make you a bit itchy in the arm. And as with any vaccination, you may feel that your immune system is kicking in and feel a little bit tired or achy for a day or two, but it cannot cause the flu. So please don't be fearful of the flu vaccine because it cannot cause the flu. This is the 12th annual year for the Drug Take Back Initiative from the DEA. It is October 22nd is the big day where different locations across the country open up facilities you can drop off medications that are expired or not used anymore, rather than throwing them in the trash can, flushing them down the toilet, and causing environmental problems. Please go to the DEA website for locations near you. However, the Radnor Township building has had a drop-off box for a number of years, I think, in the basement, which I visited a number of times to drop off medicines in there. So that can be done at any point during the open hours of the Township building. Let's see, what else? Oh, we missed it. No, October 15th was National Hand Washing Day. But we will continue to wash our hands well because just at least once since then we've done it, right? Okay. So National Hand Washing Day is another one of those CDC events across the country where people participate in different activities to remind. It's actually World Health Organization, I'm sorry, to participate in hand washing for safety. It is the #1 intervention to prevent viral infections and bacterial infections. So washing hands, let's talk about it real quick. You don't need antibacterial soap. You don't need gels or other chemicals to wash your hands. You need water. You need maybe a lubricant of some kind like soap, and you need to rub. So the key for us really is trying to remember to rub both the front of your hands, the backs of your hands, sides of your fingers, and fingernails. They tell you to sing happy birthday as the sort of the time frame for washing your hands. But all surfaces are covered with viruses, and almost all of those surfaces that we touch, we are actually getting viruses on our fingers and hands and putting them to our face. So hand washing is the best way to prevent infections, including the flu. Okay. Is there any public participation today, or does anybody have any other announcements? Thank you. Please introduce yourself, if you don't mind. Thank you.
Sarah Pilling from Garrett Hill. As a senior, I know you're a pediatrician, so it may be out of your bailiwick. But I had heard that seniors should get their flu shots not late, but later, and that perhaps, I know last year, I got it at Rite Aid, and there was a special vaccine for seniors. And I wondered if this is just hype or whether that's really true, and if seniors really should understand this. Is this what I've heard correct?
Well, I have a little bit of knowledge on that. Not, I should really get more before I speak at length on it. But one thing is there is a senior vaccine that is a double-strength vaccine. Okay. It's a higher potency vaccine. As we age, our immune systems are less able to make antibodies to the flu, and the double-strength vaccine actually helps the elderly get a better immune response to the vaccine each year. I have heard theories that the vaccine's efficacy wanes as the season goes on in older folks, and that we should be doing this more toward the flu season.
Right.
So as we move into November and December, when the peak of the flu season in this area is usually in that middle December through March, although there have been years that there have been exceptions to that, especially the swine flu year. However, the thinking that, at least the recent information that I've read, is that the CDC has determined, since this vaccine is not extremely effective, it can range in a year, different years, from between 20% effective to up to 70% effective based upon the guess on the vaccine. So in addition to the challenge of that, we have the challenge of herd immunity, which means that if enough people in a community get a vaccine, then we can suppress that virus from the community. So just the idea of everyone getting the vaccine at some point during the season actually protects the population better. So the issue becomes, how do you vaccinate 250, 300 million people in one season? It's a very difficult proposal. So the season is extended from end of August until mid-flu peak season. So there is some benefit from getting the vaccine early on to prevent the spread as the flu moves across the country. But it's something that I think that I need to do a little bit more research on to see how much information is out there about the elderly getting it too early and then losing their immunity in that one season. One more interesting piece of information that I have read a lot about is, even though the yearly flu vaccine changes and a new strain is put in each year or new strains are put in each year, just getting the flu vaccine gives you some protection against future strains. There's been evidence to show that people who got their swine flu vaccine in the 70s, when the last swine flu broke out in the 70s, that they had some protection more than the general population when it broke out again in the 2000s. So I still recommend everyone gets their flu vaccine until we have more information. I would just say, if you can get it, get it.
Oh.
Thank you.
I only ever missed it once, and I was sick as a dog for about 2 months. Thank you.
Thank you so much. All right. So if there's any other announcements from anyone or any more public participation, we don't see any more of that. Okay. Then we will call this meeting to an end, and we will meet. And I did not write on the bottom of this agenda this month, but the next meeting is November 21st. Okay. Which is actually Thanksgiving week, is it not? Yes. So please, if you guys could email me and let me know if anybody has any plans or issues prior to that meeting, I would appreciate knowing who's going to be here that week.
Did we want to talk about the black bear or anything that?
Oh, that's right. Yeah,
or any of the information you put together? I didn't know.
Was that this month or last month? Yeah.
Oh, no, that's fine.
Yeah, they got him.
I guess I was really being last night just reading about it, so.
I did forget about it. Quick update when the announcements here.
Yes, on that.
I'm really sorry.
I did hear it was
saw
captured.
It was
I
captured and
appreciated the
transported
information.
upstate.
Okay.
I did see a video.
No, I just appreciated the information that you
that was
put
good.
together. Thank you
forgot
very
it was
much.
this month. That was last month. Okay. So, on that note, on the no more black bears in Radnor Township, we will adjourn the meeting.